Okay, so I want to show that for the instrument which we commonly use in the obstetrics and gynecology. So this one is a cervical patch biopsy forceps. So we can use this forceps in other type of tumor as well, not only in cervix, but here we can use in a cervical tumor. If there is a tumor in the cervix, you just go there and grab on the tumor, then you can lock it. Then after that, you put it in the sample bottle. Then before you put the sample bottle, you open the lock, then you just put it there, then after that it is done. So you can use it for other procedure as well, not only for cervix. Then this one is another one more, same thing, but this one is without any lock. So more simple, you just put it in, then grab the tissue and then you just put it into the container. Okay. And this one is a needle holder. The needle holder, difference with the needle holder and a forceps is that if you see the forceps, tissue forceps, you can see that there is a longer shank and there are the parallel parallel lines in the shank. But if you go to the needle holder, it's a shorter shank and you don't see the parallel one. It's for the grip. This one is not for the needle, because if you put it in a needle, there will not be the enough grip. This is a better grip. You put the needle there, you grab it. There is a needle holder. This one is a tissue forceps. Okay. This one we use it for you press on any blood vessel or tissue, minor procedure, operation, gynae, obstetrics. You can use it. Okay. Okay. That one is a needle holder. Needle holder, it will be. This one is for your gynae procedure. So it's a bit longer and it's a curved one. So you just put the needle and you can suture it. So it's for the very deep pelvic cavity. This one is for superficial one, like superficial skin wound or perineal wound. You can do this one with the needle holder. Okay. And this one is a Green Armitage. We use it for the obstetric at lower segment cesarean section. This is the non-traumatizing. It's a tissue holder. So we can use this one in an obstetric and some of the surgical procedure, especially intestine, because if you clamp on a tissue, the tissue will not be injured, it will not be traumatized. So after you release the clamp, the tissue is still intact. Okay, so this one is good for the lower segment cesarean section. So when you go for lower segment cesarean section, you need this instrument minimum 4. If you get 6, is the better, because 4 means that if you had a suture, the skin incision in the lower uterine segment, upper is 1. Lower line is 1, so this left angle 2 Green Armitage, right angle 2 Green Armitage. So you need that all together 4. So this is the Green Armitage, and then the other one is a Ellis. This one is a Ellis. So this is the Ellis is a very small teeth compared to the Forcelam. Forcelam has a this one is a Forcelam. Forcelam is you can see the tip of the tooth. This is a bit bigger one. This one is Ellis is very small and fine teeth. So there is a difference between the Ellis and the Forcelam. This Forcelam, there will be the curved one or there can be the straight one. 2 types of Forcelam. Okay, this one. And this is the Ellis. And then another one is the tissue Forcelam. Oh, this one is a tower clamp. It's just for the when you do the operation, you can clamp on the towel and the whole stabilize the towel. So the towel on the patient body will not be mobilizing. Okay. And okay, this scissor has quite a few types of scissor we use in obstetrics and gynecology. This is the mesoderm. Mesoderm is a bit compared to the other scissor. We show you this one is a Mayo's. It's a longer, bigger one, bigger handle and bigger shank. And this is a Mayo scissor. This one is a same thing Mayo, but it's a carved. Some of the Mayo will be the straight Mayo. This one is a mesoderm. And then I want to show you that this is the episiotomy scissor. This is the episiotomy. It's a very typical and unique, but this one is to protect the, if you want to cut, it will be on this is a perineum, you cut that way. So this is to prevent from the fetal head injury. Episiotomy scar, episiotomy scissor. This one is Tinanculum. Tinanculum is also same thing we can use as a porcelain, but it will be very piercing to the cervix, so it's traumatizing. So normally we don't use it nowadays. Okay, this one is there, all the tissue forceps. You can hold it. This is for your calf forceps. This one is normal one. So when you hold it on the left hand, and you can suture with the right hand. So same thing with this one. This one is, what is different is, I will show you. You can see the tooth here. Okay, there is no tooth. So this one is a non-tooth. This one is a tooth forceps. So if a tooth forceps is we use for the normally the muscle. So we hold it so it's more stabilizing in the grip. This one is just for the soft tissue, like you want to hold for the fascia and ligament. Without, you don't want to get an injury to the tissue, then you use this forceps. Okay, and then this one is a sponge holding forceps. We use very commonly in our obstetrics and gynae. We can clamp on any tissue, or we can put the cotton gauze here, and you can use it for the cleaning the endometrial tissue or cleaning the vagina. Anything you can use this one. Okay, now this one is a uterine sound. Uterine sound is for the gynae procedure. You can see the centimeter. That is for the uterine length. And then if you are talking about 10 cm, there is a 10 cm uterine length, uterus size. Okay, and then this one is a curette. There will be the two ends, either sharp and blunt end, or you can see that only one. Different size. There will be different size in this diameter. So this one, either it can be sharp or it can be blunt end of the uterine curette. Okay, and then this one is a Casco self-retaining vaginal speculum. Okay, so Casco bivalve self-retaining vaginal speculum. So when you put it in, after you finish, you can tighten it so that it will not be loose and it will not be coming out. So you can tighten. Depends on the patient's vaginal diameter size. Okay, and then this one is speculum. This one is not self-retaining. You need to hold it. So this one mostly we use in the gynae, but also we can use, depends on the condition. But this one you have to hold it without retaining. This one you don't need to hold it. It can be self-retaining in the patient vagina. You can use any other procedure there. Okay, I think that's all.